Welcome to Iowa Live. I am with Dr. Ole Olson, board certified in neuropathy at Central Iowa Neuropathy right here in Ankeny. Dr. Olson, good to see you again.
Hey, thanks for coming out.
Absolutely. Now, we need to tell people about what they need to look for or feel if they might be experiencing some peripheral neuropathy pain.
Yes. So neuropathy can come in lots of different packages.
Okay.
It's not always painful.
Oh,
So
not?
yeah, so sometimes people experience pain, right? It could be sharp shooting electrical type pain, could be that dull, achy pain like a toothache in the hands, fingers, arms, legs, feet, things like that. Other times it's actually more of like a numbness or tingling, maybe like a heavy sort of feeling. And then other people, it may even start off as just maybe like feeling off balance, like just not very good balance. Maybe they've had some falls or just a little uncoordinated feeling.
So if you maybe had a recent fall and you couldn't quite figure out what is going on, that could be a symptom.
Absolutely.
All right, and what can you do for that case in case you want to check to see if maybe that is an indicator that peripheral neuropathy is the cause?
Yeah, so we actually use a system called a balance track assessment in our office, and what it does, it shows us, how off is that person's balance and what is their risk for a fall, because obviously with peripheral neuropathy, this is a huge problem, and as we age, not necessarily as we age, but as we age, balance gets more challenging anyway if we're not working it, right? Mm-hmm. So people tend to have a greater risk of falls. Well, if your feet are not communicating back to your brain properly, you have an even greater risk because we've got our eyes, right? That helps with balance. So a lot of times what happens with these people is at nighttime, they get up to go to the restroom, the eyesight's gone because it's dark. They're totally dependent on their feet, which aren't communicating back to their brain, and then they stumble and fall.
And everybody knows this, especially when it's really dark. You're going by feel.
Yep.
And if you don't have the proper feeling, you cannot balance yourself.
Absolutely.
All right, now this balance test that you have, we had a chance to jump on this, and you have a chance to see what it looks like here. And it just, there's no stress involved in this. You just stand there. How long does the test normally take?
About a minute and a half. I mean,
that's simple. That quick.
Yeah, it's real quick. But what it's doing is it's taking 4 different measurements to see, how are you doing overall in terms of your balance. Luckily, you passed.
Yeah, that was good. What did I have? A score of 13?
Yeah.
So I have that score of 13, and on a scale, where would I have had a problem if it would have read what number?
So once you get to 26, that's kind of putting you into you do have a risk of falls, kind of the mild category. And then once you get, there's a mild, moderate, and severe ranges. Once you get above 45 or 46, that's where you're really in severe trouble.
Okay.
But anywhere along there are different levels of severity, and so anytime there's any risk above 26, we want to mitigate that risk.
Okay, and how do you do that? How can you retrain yourself for balance? That's something that the brain can relearn?
Yeah, absolutely, and that's part of the program here in our office for people when they have balance issues is we give them exercises to work on at home, and then we also do things in the office to, like I talked about earlier, reconnect the system.
Wow.
So it could be hands, could be feet, right? If you have issues, buttoning your button or brushing your teeth even, we can retrain those nerves and reconnect the hands or the feet back to the brain so they're communicating at a higher level, which means you're going to have better balance, better coordination, all that stuff.
Yeah, so speaking of the nerves, let's talk about the deterioration of the nerves itself, because that's one of the causes, isn't it?
Oh yeah, absolutely. So one of the main things that we see is the lack of blood flow. So if you think of, a lot of these people, they've been tested for circulation issues, and what they're looking at are those major blood vessels, so the major ones going into the legs and feet, the major ones going into the arms, and those may be cleared, but what we look at is the micro blood vessels. So if you see that chart there, these blood vessels come in and literally wrap around the nerve. That's where the nerves get the nourishment. They get the oxygen, the nutrients, all those things that they need to thrive. And when that microcirculation is affected, those nerves start to die off. The outer sheath called the myelin sheath, which is a protective layer for the nerve, begins to decay and break down. Well, then next the nerve is compromised, so now it can start to get killed off faster.
Okay, now can we do something about that? Is there anything we can do to correct that?
Yeah, and that's really what our program is designed to do. It's to increase blood flow and circulation, get the nerves those nutrients and the oxygen they need to thrive, rebuild that myelin sheath, and start to repair those nerves, which is why this is not a fast process.
Right.
This takes time.
All right, we want to get the nerves and nutrition they need. We also need to get the folks out there watching now the information they need to make the determination of coming in and seeing you. What can we do to help them?
Absolutely. So right now we have a free seminar. They can actually come out, learn more about what it is that we do, what's actually happening inside their body, so they have a better understanding what's going on. The first 15 callers, we've got a free book that's going to come with that. So I wrote a book called Reversing Neuropathy. It explains kind of step by step some of the things that we use to help people and see if they're a good candidate so we can get them in and get them taken care of.
Okay, the phone number is really easy to remember, everybody. 515, of course, we're in Ankeny. It's 505-3700. 515-505-3700, and get a hold of Dr. Ole Olson at Central Iowa Neuropathy. Dr. Ole, thank you so much.
All right, thank you. Appreciate it.
Don't go anywhere. We'll be right back. This is Iowa.